All right. Hello, everyone. We're going to get our workshop started today. So today's workshop is titled Building Trust and Trustworthiness, How Clinics Build on the Trust Our Communities Have in Us. And this workshop is eligible for CME credit. And so if you would like to get credit for that, you can find more information at the registration and resource table in the main session. But yes, we have our wonderful speaker today, Dr. Daniel Yoder. He's based in Hendersonville, North Carolina, and he's a family medicine physician. So please join me in giving him a warm welcome.
Thank you so much, Victoria. I really appreciate it. So it's a privilege to talk with you about this topic. I get to work with, in my role as a family doctor, I work at a FQHC, which is not a Christian clinic. It's a secular FQHC in Western North Carolina. And we also train family medicine residents there. And one of the things that's been on my mind over the last year or two for multiple reasons is just how to train residents, how to train new doctors to develop rapport with their patients, how to build trust, to listen intentionally, and to really see the value of long-term relationships and continuity in building that trust. So just a little bit about my background. I don't feel like this is something I'm learning. So I don't have come speaking from a position of expertise. I want to learn alongside you. So during this session, it will not be me talking the whole time because I think we can all learn a lot from each other. Has anybody within the last 3 months had challenging discussions around trust or information or instances where patients did not understand what you were trying to offer or communicate? Show of hands. Yes, I think we all have experienced that, whether that's in healthcare, in education, in working with colleagues, in whatever setting we may be in. So this is just a little bit about where I work. It's a FQHC in Western North Carolina that's been around for a while. As I mentioned, it's not a Christian clinic, but its mission aligns closely with shared values that I have because of my faith background, and definitely works to meet the needs of uninsured and under-resourced patients in our community. Prior to being at Blue Ridge Health, I worked at Dayspring Health in Jellicoe, Tennessee, on the Tennessee-Kentucky border for 9 years. So privileged to work with a number of people that are here at this clinic, and that is really the genesis of my connection to CCHF was my time spent at Dayspring, and has made me want to continue that process of training doctors for practice in rural and underserved areas of our community. Where I work is not just the FQHC, but it's also a partnership with an area health education center and affiliated with the UNC Health Hospital. And then we live in this region of Western North Carolina. I'm in the county in the lower kind of middle called Henderson County, which is not in itself a rural county, but the areas around it are very rural. And as you can see, we have clinic sites spread throughout that region. And kind of my why for why I do what I do as a family doctor, not just taking care of patients, but also training residents, is people like this who graduated within the past year. And I'm just really proud to work with them over the course of three plus years. 4 out of the 6 of the folks from this graduating class are working in rural areas around our Henderson County site. And to see the enthusiasm they have for that care, the skills that they get to apply in a meaningful way in front of patients is very joy-giving to me. And whatever your role may be in your health center and your community, I challenge you to think about the ways that we invest in the next generation through training. And if that gives you joy, lean into that joy because it can sustain you in what you're doing. So my objectives for today are pretty simple. I'm just going to review some of the contributing factors to decreasing trust in healthcare and in science that we experience. Discuss some case studies that I've seen in my own practice recently, but I also want y'all to share with each other. So just be prepared. We're going to ask you to share some of the things that you've experienced, and then present a framework. And full confession, I was working late on some of these slides. So I said resolution, that's really the wrong term. I present a framework for maybe progress or investment. I realize that many tensions in life never come to a resolution. So I would correct my grammar in that slide. So we know a lot of the factors that contribute to decreasing trust, and because of where y'all work in health centers, free and charitable clinics, you're aware of all these things. Inequity in what's available, access to care, whether that's infrastructure, language barriers. And I mentioned in our setting, we care for, or about 30 to 40% of our patients don't speak English, speak Spanish or other languages. Health literacy, so even if there's not a language barrier, just literacy around health, and then cultural differences as well. We're in Appalachia, but we've got a surprisingly diverse group of people that make up our patients. So I will walk into a room and I'll see a migrant farm worker, but then the next room will be a retiree from Florida. So sometimes there's a real fast switch that has to happen in my mind to think about how am I going to build trust from this clinic room to the next clinic room, which is kind of fun and exciting, but also the challenges that y'all all face in your environments as well. Our recent experiences, the pandemic being one of them, but also many other recent experiences, war, misinformation, polarization, all those things. The ability of our patients, the geography, where I was in rural Appalachia, transportation was a much bigger barrier than I would think, even though distance-wise, 25 or 30 minutes, or 25 miles didn't seem like much, but if you are driving on windy roads or have cars that don't work, that becomes a big barrier. What are some other barriers to trust that you see? So just shout out some words that come to mind that I didn't mention, because this is not a comprehensive list. Hearing no? Yeah. So you kind of stop asking? Yeah. The history? Yeah. Politics and religion, yes, yep. And that goes both ways, both the patient, but also the provider, our experience. I sometimes walk into a room with if I'm honest, a chip on my shoulder, because I know I've seen this patient before and I know this is probably the topic that's going to come up, and I'm not ready for that today. And that already has subconsciously or consciously made that a encounter that's where trust has been eroded. So there's the trust of our patients in us, but there's also the reciprocal trust that we have in our patients. And we should acknowledge the effect that both have on each encounter, on our day, on our week, our year even as well. I didn't put this date on the slide because I didn't have time, but I do have it in my notes. In 1966, 73% of our population had confidence in medical leaders, whereas in 2012, so 10 years ago now, only 34% did. The articles I was reading didn't have updated numbers, but I'm sure it's less than 34% now that have trust in medical leaders. In 2017, there was only 18% of the population that had high levels of confidence in the U.S. health system. So these numbers all predate the pandemic and predate the things that we've experienced within the last 5 or 6 years. And we know that has eroded. I think I have heard encouraging news that some of these data have shown a slight uptick, but that's only a short period of time. And as much as we don't want to make our decisions or change things based on public opinion, I think what this represents is that some of the things that we were doing to build trust weren't working before the pandemic, and they've only gotten worse since then. And so we already had our work cut out for us, and we have our work cut out for us going forward. So when I've been talking to medical students that are entering residency or residents, I sometimes say this is going to be the work of your generation. It's my generation's job too, but your generation to build trust in the healthcare system and in your role as a physician or a leader within healthcare. So the problem continued. Some of those were patient factors. There's the provider factors. There's burnout. There's misinformation that we're all dealing with. The global pandemic, and then changing views of professionalism too. As you talk with healthcare providers, with nurses, therapists, social workers, I hear this sometimes too. Please don't. If I reference my job as a vocation or as a calling, I sometimes hear the response, "Well, I don't see it that way. It's a job. It's a way to get money," and so we have to listen to that and acknowledge that not everybody that we're working with, even in a Christian health center or in a free and charitable clinic, may see the idea of a profession or calling in the same way that we have interpreted it or seen that story. So that's just something to be aware of. I haven't fully wrapped my head around what that looks like or how to respond to that. That's one of the things where I would welcome wisdom from you. So just some recent examples in my life, probably from the last few weeks and going back even more to years. I think 2 weeks ago I had a patient presented to my clinic, and he was wearing his overalls. He works in a small engine shop. Has poorly controlled diabetes, and that's kind of wax and wane. Sometimes it's well controlled, but when I was seeing him then, it was poorly controlled. And he said, "By the way, doc, I don't believe in that stuff about parasites causing diabetes." And I didn't know this was a thing. So I learned a new form of misinformation. So I had to go do my research, like what are people saying about parasites causing diabetes? I forget what it is, but it's definitely out there on social media. So that was a example of, you think you've heard it all, and then you hear something new, and sometimes I have had the response of, that's not true. That's, I don't know where you got that from, but I'm learning that my response should not be to discount what somebody is saying that they heard, but I should say, well, let me look this up, or let's look this up together. And I think I've gotten more in the habit of looking something up in the room, turning the computer to face my patient and saying, is this what you're talking about? Like, is this what you heard? So that we're at least having a similar frame of reference when we're having that discussion. We're all aware of the measles outbreaks in Texas and South Carolina, different parts of the state. So, thankfully, it affects us because where we are in Hendersonville really borders that region of upstate South Carolina that's been affected. And so have had a lot of conversations with parents that are both anxious and fearful about measles, maybe more than they need to be. Also, some that are still concerned about the effects of a measles vaccine on their children, and really trying to provide accurate information in the moment, knowing that many of those same families and communities dealt with the confusing information and confusing guidance that came from health leaders in the midst of the COVID pandemic. And really, this is an opportunity to build trust as we respond to that. And I think even though the measles has been more regional and not as widespread as a global pandemic, it's certainly given us an opportunity to build trust and to listen. Where I used to live, I still live in Appalachia, but it's not as rural as where I was in Jellicoe, Tennessee. I have Joseph Thomas, who's here with me, that we lived and worked together in Jellicoe for, Joseph was there longer than I was even, and can speak to the barriers that were there, the stigma around substance use disorders and their treatment. And that was one of the situations where I even had my own bias and my own perceptions around substance use disorder that I had to learn and become more informed about as I was interacting with that. So those are just some examples from my own recent experience. So now this is where I want us to be interactive and talk. I would like for y'all to pair up in groups of 3 or 4 and to share, for one person to volunteer to share an example where you've had to combat mistrust or misinformation in a clinic encounter or another space. And I want, one person to choose to be like the reporter or the consultant to listen, And then I'm going to call on somebody from some groups to share what you learned or what you noticed from that. So we'll do this for about 10 or 15 minutes. If you're in a group with like everybody from your own clinic, I would encourage you to move around a little bit. The one thing I've learned from CCHF is the most powerful thing is the connections and friendships that I make and the ways that I learn from each other. So let's do this for 10 or 15 minutes. If you need any guidance, I will circulate and come talk. And one more slide. So discuss an example of breakdown in trust. It could be health related, not necessarily. If you need to make up an issue, you can make up an issue. Practice listening, and that reporter will report out. And here's some guidelines for the reporter or the person that's listening to kind of pay attention to these things. I know we could keep talking, and you're probably learning more from each other than you are from us. So continue. You don't have to get up and move back around if you're comfortable where you're sitting in your groups. But I do want to, in the interest of time, continue on. Would anybody be willing to share some answers or insights that they learned from their conversation? A reporter. I'll pick this group over here. Come, share. Yeah. You knocked down the table. Uh-huh. Just an example of what you've experienced. Yeah. And who's being mistrusted in that situation? Is it the doctor or the nurse in the room with the patient, or is it something else? Because sometimes we take that personally, like, oh, they don't like me, they don't trust me in that moment. But maybe in that situation, it's not the provider, it's something else, the manufacturer, the CDC, yeah.
I think it's different. We're comparing our different communities,
Mm-hmm.
and sometimes it's like medicine as an institution.
Mm-hmm.
Also, in other communities, it's more like research, new research.
Mm-hmm. Mm-hmm.
Other ones, it's like someone so knows a person who has this adverse event, or they have this lawsuit going on.
Mm-hmm.
Instance where they got multiple vaccines.
Mm-hmm.
What caused it.
Yep.
So like personal relationships with people.
Mm-hmm. Mm-hmm. Yep. Okay. Thank you for sharing. I really appreciate that. Anybody else want to share something you learned or insights? Yes, Cindy. All right. Yeah.
First off, I want to say medicine, which is true. That we just talked about what probably all of us have experienced in the last year with the immigrant population and the fear factors
Mm-hmm.
coming into the health center, and how do we build that trust? And she expressed that in her position, they having to just help one person explain all paperwork, explain why, and all of those pieces, and then all of a sudden have more folks coming in, ones that are there.
Yeah. Mm-hmm.
Person.
Mm-hmm. 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 Yeah. Yeah. No, that's a good example. I see that in our health center as well. People come in, they're not looking for me, they're looking for the patient navigator or the front desk person that they know helped them the last time. So every clinic member, every person plays a role in that building of trustworthiness. And so we're building trust, but we have to be trustworthy to earn that trust. Anybody else have something you learned that you want to share? Okay, I'll move on. So I was, we're at the Christian Community Health Fellowship Conference. I was struggling to think, how do I connect this with the Bible and with faith, and realized that the story of Ezra and Nehemiah is a really powerful way to think about that. Nehemiah and Ezra both had been exiled to Babylon in captivity, and came back to their community really as somebody who's been away for a long time, 30, 50 years longer, maybe didn't even grow up in that community, and were coming back to try to rebuild a community, to try to build trust and show themselves trustworthy in the communities they were going into. And I found it a really powerful metaphor, and I was thinking, they built the wall. And then I realized, well, there's a kind of more to the story. We know that Nehemiah visited. He had help from the leader of, I think King Artaxerxes sent him, and he kind of went around and looked to see what the area looked like before he showed up in secret to see what was needed. So he's gathering information, and then they started working, and they built the wall. And I think about this verse, which I know have heard very commonly from Nehemiah. We built the wall, and it was joined together to half its height, for the people had a mind to work. And that's kind of my 30,000-foot view of Nehemiah and what happened. And it sounds like a really good story, but we all know that life is messier than that, and walls don't get built that fast. They get torn down quickly, but it takes longer and it takes more time to build them up. And so if this works, I was going to show you an overview from the Bible Project that really helped me understand what was happening in the story of Ezra and Nehemiah, that it wasn't as simple as I had even perceived of it, even though I've grown up in church and heard this story very many times. That the tension that's there is real, and it's a tension that we really live with throughout our lives. We don't necessarily get the fairy tale ending that the wall was built and things were all okay. So if this works, we will watch this video. Let me click on the right spot. Obviously, I didn't. There it is. There's my link. Okay. Cool, thanks.
The books of Ezra and Nehemiah, in most
Sound.
books are separate, but that division happened long after it was written. It was originally a unified work written by a single author. The story is set after the Babylonians destroyed Jerusalem and its temple and took many of the people into exile. And this book picks up about 50 years later and tells the return of some Israelites to Jerusalem, and then what happened when they rebuilt the city and their lives there. Specifically, the book focuses on three key leaders who led the rebuilding efforts. You have Zerubbabel, then Ezra, and then Nehemiah. And the book's design focuses on the efforts of each leader. Zerubbabel leads a large group of people back to Jerusalem to rebuild the temple. Then about 60 years later, Ezra arrives in Jerusalem to teach the Torah and rebuild the community. And then he's followed by Nehemiah, who leads the rebuilding of Jerusalem's walls. And these three stories are designed to be parallel. Each begins with the king of Persia, prompted by God to send the leader to Jerusalem, and he offers resources and support. And then each leader encounters opposition in their efforts, which they then overcome, but in a way that leads to a strange anticlimax in each of the three parts. Let's back up and see how it fits together. So the story begins with a decree from Cyrus, the king of Persia, and he's moved by God to allow the exiles to return to Jerusalem and rebuild the temple. And the author says this fulfills a promise made by the prophet Jeremiah that the exiles would one day return to Jerusalem. Now, this fulfillment should trigger our hopes in the many other prophetic promises that exile was not the end of the story. We have hope for a future messianic king from the line of David. We have hope for a rebuilt temple where God's presence will dwell with his people. Hope for God's kingdom to come over all the nations and bring his blessing, just like he promised to Abraham. And so it's with all these hopes in mind that we read on into the story of Zerubbabel. His name means planted in Babylon. He represents the generation born in Babylonian captivity, and he leads a wave of Israelites returning to Jerusalem. After they settle there, they rebuild the altar for offering sacrifices, and later the temple itself. The foundation laying ceremony, and then the temple's final dedication, these are key moments. The past stories of the tabernacle and temple's dedication should be in our minds. This is when the fiery cloud of God's presence is supposed to descend. He's dwelling with his people, and it doesn't happen. And so while some people are happy about this new temple, the elders who had seen the previous temple of Solomon, they cry out in grief. It is nothing like their glorious past or their hopes for the future. And it's right here that we get the first story of opposition, and it's very odd. So the grandchildren of the Israelites who were not taken into exile, they had been living in Jerusalem all along, they come to offer help with the temple rebuilding. And Zerubbabel refuses. He says, "You have no part in our temple." And this, of course, generates a conflict, which Zerubbabel overcomes, but it's very strange because the prophets had envisioned that the tribes of Israel would all come together, along with all of the nations, to participate in the worship of the God of Israel when the kingdom finally comes. So this is an anticlimactic moment, to say the least. In the next section, we zoom forward about 60 years and we're introduced to Ezra. He's a leader among the exiled Israelites in Babylon. And he's a Torah scholar and a teacher. And so he gets appointed by Artaxerxes, king of Persia, to lead another wave of people back to Jerusalem. And Ezra wants to bring about spiritual and social renewal among the people. Our hopes are high. And again, we come to another anticlimactic moment in the story. Ezra learns that many of the exiled Israelites that had come back, they had married non-exiles who had been living around Jerusalem. Some of them were non-Israelites, and almost certainly some of them were. Ezra then appeals to the commands of the Torah, that Israel was supposed to be holy and separate from the ancient Canaanites. And he then says that the people living around Jerusalem are like the Canaanites. They're going to corrupt the exiles. So Ezra offers a prayer of repentance, and it's very heartfelt. But then he rallies all the leaders and enacts this divorce decree that says all these marriages should be annulled, the women and children sent away. And then the decree is only partially carried out. We're given a list of some of the men who divorced their wives. The story is very strange for a number of reasons. First of all, God never commanded Ezra to do any of this. It was the leaders of Jerusalem who led Ezra to make the decree. Second, the contemporary prophet Malachi, he did say that the exiles should care about purity, but he also said that God was opposed to divorce. And so the mixed results of the decree, this all fits into this pattern of a strange concluding anticlimax. Which leads us to the next section about Nehemiah. He's an Israelite official serving in the Persian government, and when he hears about the ruined state of Jerusalem's walls, he prays and then gets permission from the Persian king Artaxerxes to go and rebuild the walls. The king even gives him an armed escort and all these resources. So after arriving in Jerusalem, he begins the building project, and he too faces opposition from the people who had already been living around Jerusalem. Once again, we face a tension in the story. The contemporary prophet Zechariah said that the new Jerusalem of God's kingdom would be a city without walls, that God's presence would surround it, that people from all nations would come and join the covenant people. But Nehemiah seems to operate with the opposite vision. He informs the people surrounding Jerusalem that they have no part in Jerusalem. And this, of course, provokes them to hostility. And so while Nehemiah carries out his vision for the city with integrity and courage, they have to build the city with armed guards to protect them, we keep wondering, could this whole conflict have been handled differently? And this all leads to the conclusion of the book in two movements, first positive and then negative. Ezra and Nehemiah combine forces to bring about a spiritual renewal among the people. They gather all the exiles together for a festival. They read and teach the Torah to all the people for 7 days. And then they celebrate the ancient Feast of Tabernacles to remember God's faithfulness from the Exodus and the wilderness journeys. Then they offer a confession of their sins. They vow themselves to renew the covenant, follow all the commands of the Torah. And they finish with a great celebration over the temple, the walls of Jerusalem. And we're thinking, this could be the turning point, but it's not. The book ends on a huge downer. Nehemiah tours around the city, and he finds that the people have not been fulfilling their covenant vows. So Zerubbabel's work is undone as he finds the temple being neglected and staffed by all these unqualified people. He then discovers that Ezra's work is being compromised. He finds everyone violating the Torah, people are working on the Sabbath, and even his own work on the walls is involved because people are setting up markets around the walls of Jerusalem and working on the Sabbath. So Nehemiah, he goes on a rampage. He's beating people up, he's pulling out their hair, and he's yelling, "Obey the commands of the Torah." And his final words are a prayer that God would remember him, that at least he tried, and the book ends. I mean, it's very strange, but we've been prepared for it, right? These anticlimactic moments have been woven into the book's design intentionally. And so it raises the question, what on earth does this book contribute to the storyline of the Bible? Well, remember, the book started by raising our hopes in the prophetic promises about the Messiah, the temple, the kingdom of God, and then none of it happens. So even though Israel is now back in the land, their spiritual state seems unchanged from before the exile. And while Ezra and Nehemiah, they do their best, but their political and social reforms among the people don't address the core issues of their heart. So what the book is pointing out is the same need highlighted by the prophets Jeremiah and Ezekiel. What God's people need is a holistic transformation of their hearts if they're ever going to love and obey their God. And so the book ends on a downer, yes, but it forces you to keep reading on into the wisdom and prophetic books to find out what is God going to do to fulfill his great covenant promises. But for now, that's the book of Ezra and Nehemiah.
Any thoughts? It is a little bit of a downer. But I think it reflects the messy reality that we all deal with as we're interacting with complex situations and communities that have had varying experiences of healthcare, of church, of community in general. And this helped me process through the hopes that I have, but also in a way that I think is more realistic than I sometimes can be in my idealistic phase. So these are the things that Nehemiah did well. He was a servant leader. He empowered people through shared purpose. He was vulnerable. He gave up his allowance from the king and was working alongside on the wall. He was courageous, and he was a person of integrity and conviction. Those are all things that help build trust and show that we're trustworthy. But as we know with any leader, we're all in vulnerable positions. Even if we do these things well, we're vulnerable to not always being consistent in our actions. We're vulnerable to being disappointed and being frustrated and wanting to give up. And if we look at things from the world standards, we would view success as getting that wall done, having the temple being the way we wanted it to be, having God's glory come down and be present with us. But success in biblical wisdom and in biblical terms is not the same as the world's terms, and it is really along the lines of faithfulness, along steadfastness. And those are that faithfulness is what God promises to reward. And this was a quote that somebody was kind of commenting on the book of Nehemiah. If we think God's calling is for us to be a success in our work, in our marriages, our families, our ministries, our clinics, we will be endlessly frustrated because everything that we build or rebuild, trust being what we're talking about here, has a way of falling apart again. So we will keep working to rebuild trust, but it's always going to be an ongoing challenge, a struggle. We are ruined people living in a ruined world, and our ministries constantly have to grapple with that reality. However, our true calling is to be faithful to God and to trust that in due time, Jesus will rebuild everything that is ruined in our own lives, as well as in the lives of those around us, in the lives of our communities. So solutions that I think of as I think of building trust. So coming back to what we all talked about, like in the moment, this is the Nehemiah Ezra story is a big picture, like that's happening over lifetimes, over generations. In the moment, these are skills that really do help to build trust and to show trustworthiness. So attention, listening, building relationships, continuity is super important. Cindy talked about that, knowing somebody's name and knowing who to go to. Combating misinformation. There's a great resource from the U.S. Surgeon General about combating misinformation. It gives a toolkit that's like a graphic novel form. I see somebody shaking their head that you've seen that resource. So I encourage you to look that up. There are community resources. So a lot of our communities, if you reach out to the county health department, there's a county needs assessment. And that county needs assessment will help you know what your community has said that they need, what they need from their government, what they need from their healthcare system. And that's a great place to start. And you don't have to go knock on everybody's doors to find out what they need. Although knocking on doors is really, really good. But use those community resources that are already there. Find shared language to talk about things. Make sure you're using appropriate health literacy resources and not talking over people, using terms and ideas that aren't understood. And then creating shared meaning, which takes a long time to create shared meaning. That's stories, that's art, that's gathering, that's potlucks, that's picnics, volleyball games, all those things, dodgeball last night upstairs. That creates shared meaning over time within a community, both locally and in a region. Our part of Western North Carolina went through Hurricane Helene about 2 years ago, almost 2 years ago now. And what I saw in that moment were a lot of these behaviors that really helped us to build trust. Our residents and faculty really going out to be with people on home visits, listening, meeting their felt needs, communicating clearly, treating everybody with respect and dignity, and then creating partnership and following through on those commitments. And in clinic setting, it looks like having access to a familiar team and access in general, attention to detail, comprehensive care as high of a level of care or scope of practice as we can provide, and then making sure that the work is shared so that it's not one person's responsibility. It's not just the provider or the nurse, but it's really the whole team, the whole clinic taking responsibility. Part of my interest in this is that my brother works for the CDC, and he's had to deal with lots of the pushback and even honestly reckoning with the fact that they made lots of mistakes. They did not communicate well during that pandemic. And he had the opportunity to go to Texas during the measles outbreak and sat in living rooms with people that had a lot of questions about vaccinations and about measles. And there's an article on the Christianity Today that reflects on that discussion, and some of my brother, his name's Jonathan Yoder. I'm really proud of him, you can tell. And just the way that he would sit and listen to people in their living room. And this was a quote from the person that wrote the article that I think helps us to think about really in the kind of face-to-face meetings is where we combat misinformation, where we build trust. That night was off the record in somebody's home, but I can tell you everyone was curious and kind. We didn't hide our differences of opinion, but we listened and asked sincere questions. It's harder to reduce people to an opinion you dislike when you're looking them in the eye, when you're talking to them face to face. And that's true for measles, that's true for vaccines, that's true for policies and decisions that we're making in our clinics. And then this is a quote from somebody that leads the American Board of Internal Medicine, talking about how as physicians, our role is not to, we certainly want to speak for science, but our role is not to defend science. Our role is to defend patients. That's who we're there for, the people that are in the room with us. We can talk about the benefits of X, Y, and Z treatment or vaccine until we're blue in the face, but it should come from a place of humility, trying to respecting the person in front of us, and a recognition that trust is not granted by the credentials behind our name or even the time that we've worked in this field, but the humility and respect that we're giving to the patient in front of us through listening, honesty, and alignment with the needs of those we serve, which I know are values that each of you have in your clinics and in your spaces. And then lastly, I think I would like to close with this quote because it reminded me of some of what I think the people in Ezra and Nehemiah's time were experiencing. There was this sense that they had, there was a place, there was a temple that had God's glory, and it was destroyed. But they wanted that back. They had that memory of what that was like. And so Frodo would like to save the Shire if he could, but there have been times when I thought the inhabitants too stupid and dull for words, and I felt an earthquake or an invasion of dragons might be good for them. But I don't feel like that now. I feel that as long as the Shire lies behind, safe and comfortable, I shall find wandering more bearable. I shall know that somewhere there is a firm foothold, even if my feet cannot stand there again. We have the present kingdom of God, invisible, we cannot see, but the future kingdom of God that we are hoping and looking forward to. We do not have the Shire like Frodo had, but we do have that future and coming kingdom that we can hold on to. And I think that gives me hope and sustains me in thinking about how to build trust, even if I know I'm going to experience the anticlimax, the tension that Ezra and Nehemiah experienced as they were dealing with day-to-day problems, and as they were making mistakes too, because I guess the reality is we make some of the same mistakes that Ezra and Nehemiah made, where we think we're doing the thing that God wants us to do, the thing that's going to accomplish our goal and bring success, but sometimes in doing that we actually cause harm as well, and we drive people away or we create problems. And that's the messiness of life. But we have the hope of reconciliation, the hope of a coming king that can help us to continue to be trustworthy and build trust. Okay. And then my last slide was just some of these solutions in different language. Slow down, be intentional, show up, be reliable, tell the truth, be transparent, build community, and then, of course, use your in-person voice, your face-to-face voice, not your social media voice. That's all that I have. Thank you for listening. Happy to have any questions or have any further conversations.
Thank you all so much again. We also have this survey that we would love for you all to fill out. So I'll just be walking around the room so that, or unless you guys can do it from here, but I'll also just come closer just in case. So.
And it should be in the poll app of your.
Oh, the Whova app?
Yeah.
Yeah, it should also be in the Whova app as well. So yes, it would really be helpful just to hear y'all's perspectives and help us to continue to improve the conference. So thank y'all.